Hey everyone, today I'm going to talk about chapter 8, which is all about using health services. There are some questions here. The first one going to be recognition and interpretation of symptoms. Second one going to be who uses health services. And the last one going to be misusing health services. I'm going to start with the second question. And because it sounds very simple, who going to use health services? Of course, someone who is sick, right? But what is the definition of sick? Because like it's just different from one person to another, right? Some people they would just have a minor headache, they would just stop working and all that, but some other people they can just perform and they wouldn't even call a migraine sickness because migraine is just happening to them all the time. But if God forbid it would just happen to me, I would I would shut down everything, seriously, because it's a serious problem. But like the definition of sickness and the level of knowledge of being sick is just some sort of individual differences and different from one person to another and different from one culture to another one. So here we basically gonna talk about how we can just categorize recognition of symptoms from one person to another. There are like different factors that can just help us to just understand who can tolerate sickness better, who cannot, or who can just report them and who cannot. The first one gonna be individual differences. Like I said, there are some people that they're gonna stop working if they feel like a bit of uncomfort or something like that. But there are like some other people, they wouldn't care about a minor problem, they would continue working. I do have students, they would just literally email and say, hey, I feel like I'm having a headache today. I cannot concentrate on the concept, so I prefer just not come. I mean, for my in-person classes, they would say, I prefer not coming to that class because I feel sick. I can understand that. And actually, it's a good idea because they wouldn't make every other student sick as well. But I do have some students, they're literally dying during the class because they are just coughing, sneezing all the way. But they wouldn't care. They would just come to campus because they know that if they wouldn't come, they might not understand the material or might lose a point. I can understand both groups, but I mean, students, people, they are different. There is one group of people, they are hypochondriacs. I guess you know about them. They actually convert everything, every distress to physical problem. For example, if they would have severe anxiety, they would convert that to some symptoms like headache, back pain, joint problems, or something like that. There's another group of people, we already talked about them, neurotic people. They are in general very negative about everything. They would just interpret everything like super negatively. They are just very self-conscious. They do have low self-esteem and all that. We talked about that before. But they're gonna exaggerate their symptoms. For example, if they would have a headache, they would just say that, oh, I do have a big tumor in my head, so I have to just go and get X-ray, PT, or like something like that. Or they gonna be very attentive about the real symptoms. For example, if they would have a sore throat, they feel like again there is a lump here that they have to just do X-ray, they have to go to a physician and just address that. Attentional differences. I really like this section because like it's just basically talking about people who are just more focused on themselves. They're gonna notice the symptoms quicker. But there are like some people they do have a lot going on in their life, so they would pay less attention to their symptoms. The best example here gonna be your mom. Or yeah, it's just gonna be your mom because like your mom gonna work, I mean, outside probably. They are working inside of the house. They are doing all the chores, they are cooking and all that, and they are sick sometimes, but they would continue working for the whole household. On the other hand, we do have our dads, and most of the time, if they would get like a small flu or like something like that, they would just burn the house to the ground. They would just say that, oh, I'm very sick, I cannot perform at all. Everyone should be quiet and all that because they are sick. Yet super moms, they are just working a lot, they are sick, but they are just make everything done. So that's the difference between attentional differences, because moms, they are always having a lot going on, but the family comes first. I mean, they are so good. I love moms. So another factor gonna be situational factors. It seems like boring situation, like whenever you are bored, you would pay close attention to your symptoms. I do have a friend, she doesn't have anything going on in her life. Like her life is just very predictable. So like almost every day she would just text everyone and just say that, oh, for example, I do have that kind of symptoms. I feel like it's serious. So she would go to the doctor, she would address that. And I mean, the end result gonna be nothing. She's healthy, but she's just bored. She's living in a very boring situation. So situational factor is very important. Another example of that gonna be medical students' disease. It seems like medical students are reading about all these problems, so they would actually feel like they do have it, because like they are in a situation that they are addressing everything, and they are working in the hospital most of the time. So probably they are right. They are having like some sort of small problems, but they would exaggerate more and more. Another example gonna be me. Back then in college, I was doing clinical psychology and I was reading different like psychological problems and mental health problems and all that. And I was practicing, um, like I was seeing patient and all that. Oh my goodness, I do have a sore throat. Maybe it is serious, but I have a lot going on, so I don't have time for that. But yeah, so when I was a clinical psychology student, I would actually think I do have all the psychological problem. So when the patient, she was talking to me about their ADHD, I was like, yeah, I do have ADHD. Like I was telling that to myself. Then comes another patient. He was talking about his bipolar problem, and he literally had it because like based on the experiments and all that, he had it. Then he left, and I was literally thought, yeah, I'm bipolar too. Because like sometimes I'm very happy, sometimes I'm just very grumpy. Like you see what I'm saying? Like every patient that I was just seeing them, I would just diagnose the same problem in myself, which was crazy. I mean, I'm very glad that I didn't have someone with schizophrenia, because if I would, I would actually feel like, okay, I do have it too. So, situational factors, they are very important as well. Stress. Of course, I mean, whenever you are stressed, you're going to interpret everything as illness as well, because you are stressed all the time. Mood and emotions, it's gonna affect your perception a lot. And it's gonna actually bring you some sort of vulnerability to illness, because whenever you are in a bad mood, your body is not that much immune. We already talked about that. So it can be the last factor of